Hi, my name is Helen Henry Anonike. I will be presenting on the topic health promotion, and I will be using 20 minutes on the presentation as instructed. So the next one on my slide is the table of content, which is the introduction model of health promotion, comparison of the two model using health promotion, and also evaluation of effective and model in promoting good health, and also the explanation, aims and objective of health promotion. I'll dive down into the evaluation of effectiveness and the initiative in promoting good health, and also the next one is going to be an appropriate agency or organization that contributes to making the improving of public health, and also my conclusion and my reference will be as followed. The next one on my screen is model of health promotion, which is shown on my screen. Health promotion refers to the process which one enable people and the community to gain control over and also enhance their ability to lead or live healthy life. It also includes learning, it includes changing, creating healthy environment, and developing policies that will maximize risks and promote health. Health promotion makes people to assume responsibilities for making good choices regarding their health through their lifespan. Next on my slide is still the introduction of health promotion. I'll say that health promotion is not an absolute science where all the situations have the same answers. There are certain theoretical bases for health promotion, medical, which are the medical and preventive paradigm, which is based on the epidemiology. In this paradigm, this paradigm sees health in relation to being free from disease, and also clinical example of these are the immunization which are used in their paradigm. This type of paradigm is to say to be top up, and then also where the practitioner takes charge is. And then social changes paradigm, which emphasizes on the determinants of health. This paradigm state their own choices, but because of housing, jobs and availabilities, and education. The next one on my slide is comparison, which is shown on my screen. Comparison of these social models, which is a table has been drawn to show the futures, medical and also the social models of this, which is the philosophy. The philosophy part of it on the social models are the pathogen, which focuses on what makes us heal, and the social models of it is Solusogen, which focus on what makes us well. And the next one is the intervention, which is the primary vaccine, and the primary vaccine. The secondary is the screening. Then the next one on the social model is policy changes, which is the environmental and the improvements. Okay, then the locus of control under the futures give the medical practitioners, the experts, and then the social models are the community lead, which is the empowerment aspect of it. And then examples of these are prescribing statin of their high cholesterol, and then the social model of this is taxing surgery drinks or building bike lanes, which is very important in promoting health promotion. Then diving into the theoretical framework on the models, the Neons of Betty, which is a typology in 1991, which stated the need to Betty's model in higher operation, which arise from the fact that the health promotion can sometimes be a struggle of power, and then this strategy can be strategized depending on whether they are top down or also bottom down, and whether they are intention is for individuals or groups. Okay, so we have the healthy persuasion, we have life changes in law, which is the population of the authority, And then we have the motivational counseling. We also have the community development. If you look into the healthy persuasion, it's about the individual authoritative, which is the example of it is when a doctor advises his patient to lose weight, and this technique is just highly effective, and then it causes victims blaming. And then the one of the changes in law is the population authority. For example, the sugar tax in UK, this changes the environment such that the healthy choices become the difficult point. And then the motivational counseling aspect of it is the example of it is motivational interviewing, which is the strategy. Which this strategy allowed the personal freedom but required many resources. So the community developmental approach for this model is population and the negotiation. For example, the food corporation, and which creates the sustainable results, and also efforts are required, which cannot be scaled up easily. So the next one is the Tannehill. The Tannehill model from 1985 to 2005 also figure the best way to show connection between fields. This model has 3 interactive circles, and then the first one is the health education, which include the attitude and the behavior. And then the second one is the health protection, which require the economic element, which is the regulations on seatbelt. And then the third one is the disease prevention, which is the medical element. Example of these are disease screening. And then the evaluation, which makes Tannehill framework a very strong and holistic approach to healthcare. But his weakness is could be the point of a year where the model is too medicalized, and it failed to consider the social determinants of the health, which is the STOH. And then the next one on my slide, which is shown on the screen, is the evaluation of this effectiveness. I like to dive into it by saying that there is no alternative model to deal with this infection and emergency apart from the medical models, which is the problem with medical apart from with this. However, the problem with these medical models is that there is an overlook of a number of psychological elements, which the influence of the reason for individuals are getting sick and resulting in involving those syndromes. And also the empowerment and social models works very well when they are dealing with the problems like health and disparities. And although the individual get agencies which enhance them to make for sustainable behaviors changes. Unfortunately, I would like to say that it is difficult for the finances and the finance to evaluate this, because the benefits cannot be seen only after years, as is reduction of the heart disease and the patient. The power of this Tannehill's approach lies in the holism. The biggest weakness of this is the tendency to be too medical and not just not taking into account of the SDOH, which is the upstream factors, and such are poverty and housing. So the health promotion, which is shown on my slide, selective initiative, which is the immunization program, I say, the aims and objective of this are the vaccination program, which is just one of the many programs offered by the public health department to prevent people from contracting these infectious diseases, and also can avoid via immunization. The main purpose of this conduction of vaccination is vaccine is a program to lower down cases of illness and also death among the young one, the pregnant women, and also the old population. So when I dive in down to my health promotion initiative, I'm going to be specific on the objectives, which is including the percentage of immunization, which should be more, which is more than 80 to 90% of for health immunization. And also the immunization independent of this certain disease are measles, polio, and also tuberculosis and hepatitis, and then to eradicate any of this communicable disease, if possible, for the instance polio, educating individuals regarding the significance and the safety of the immunization. The next one on my slide, which is shown, is also the continuation of the vaccinating of all the individual in the society, especially in the rural society. An example of this immunization program include which is started in Nigeria, it include immunization program from primary center, immunization program from NPA, evaluation from NPA, and then the next one is evaluation, evaluating the effectiveness. In the immunization program, one of the most successful public health program through this the world, throughout the world, the program has helped considerably to reduce the elimination of dangerous communicable diseases. There are no doubts that many are indebted to effect of immunization, which is the World Health Organization in immunizing the entire population against dangerous diseases like polio and measles. What I admire most is about the program is the preventing of nature of the program. Then going down on one of those is to incur any cost whatsoever she or he uses this program, is because they cannot get those diseases. Most importantly, the program has helped to create herd immunity very well. However, there is also a lot of related problem to vaccination process. The first biggest problem that exists is the case of people tend to resist getting vaccinated because of their misunderstanding about vaccination. And then the second issue may rise from the process of related necessity to maintain some specific temperature which these vaccinations are being stored. And in many remote places, health institutions cannot establish due to these conditions. To conclude, I would like to say that although the impact of these vaccinations on our society has been rather positive improvement, which can be made, the impact is derived from vaccination, which is the highly positive, by educating people continuously, along with having poor healthcare system in place. The effectiveness can be enhanced significantly, and the aims and objective of this is to reduce the obesity and improvement of family diet. Objective include increasing the daily physical activity and also reducing the assumptions of hidden sugars in the process of food. The next on my slide is improving public health, which is shown on the pictures, which is the public health. I'm going to be evaluating the World Health Organization, which is acts as the custodians of global public health. The evaluation of this effectiveness may be considered from following three important pillars, which is the standard norms, the crisis management, and the monitoring. What is the standard norm? World Health Organization has provided us with the international classification of this disease, which is the ICD, to ensure that there is a uniformity of the language and in the medication, in the medicine, and across the community. Then the crisis management of this monitoring is the global outbreak alert and also the response network, which is the GORNG, in bracket, the body monitor potential threat in the real time. The early warning sign is the very vital, which is making sure the local outbreak are not to become a pandemic. The next one on my, the third one is addressing health inequality. World Health consider this an emphasize on developing the nation, which is addressing issues like mental death, maternal death, and also access to safe drinking water. It also measured not by the absence of diseases, but the Human Development Index of the countries, which is insists on the critical analysis. So diving down to the critical analysis impact. Sorry. Though the World Health is necessary, there are also certain factors that limit the effectiveness of this functioning. These are in a political way, it's a resilience of funding from powerful member, and the countries may influence in objectivity. Non-compliance, it provides the blueprint of health matters. However, it lacks the authority to implement the laws and within the sovereign countries. And also, however, some limitation rises despite the approval of the achievement. For example, the World Health Organization is funded and sponsored by its members and also external parties in quote, which means that it is operational. Its operations will be effective. Additionally, it may experience difficulties when implementing its recommendations on a national scale of political, economical, and also cultural reason. The next on my slide is at the conclusion, I would like to conclude by stating the fact that the World Health has greatly contributed to the enhancement of health standard globally. It also contributes to public health, which is a nice NICE, which does not just take look at what works, it also look at the cost effective, which is the value of this money. And then the public EBN, they have formulated a quality standard which all the NHS trusts are subject to. This implies that if there is an individual which is treated in London, and he or she will receive similar treatment as another individual, and also being treated in Manchester the same way. Measurements quality, the tools used in evaluating this health promotion activity is quarterly adjust live years, which is for the instant. The formula circulation is quality, which is the product of time, and also live in quality life of the weight, which is the utility value, and is in a scale of 0 to 1. 0 means death, 1 is full health condition, and 0 to 1 implies different health status. And in my conclusion, I'd like to conclude the whole promotion by highlighting the area of health promotion, which may be very, very considerate and quite complex, which demand the consideration of degrees of the coherence between the theoretical assumptions and also practical implementation. Though, according to the critical reviews of this model, the purpose by Tanner, Hills, and Betty has been asserted that many program implementations to improve this is the state of public health should combine both top-down and also bottom-up strategy. This strategy may be elaborated through the integration of upstream and the downstream method in the context of social determination approach of health promotion. I would like to end my presentation with the references, which is highlighted in a very proper way. That is the end of my presentation. Thank you as I end the presentation. Bye.